Today, all the speakers again are joining this briefing virtually to adhere to social distancing guidelines. A reminder to those who have joined the Zoom conference that this is for press only. All participants should make sure that their login name indicates their media affiliation. You can change that by mousing over your name, clicking more, and then choosing rename. We'll begin our briefing now with opening remarks from Mayor Kenny.
Good afternoon, everyone. As you know, the COVID surge facility at Temple University's Liacouras Center continues to prepare to receive patients affected by the coronavirus. Today, I'm pleased to announce that this site is now ready to accept patients, though we obviously hope to never have to use it at all. As more people are hospitalized with COVID-19, hospital space is at a premium, and the Liacouras Center facility is now set up to help alleviate that situation. The city is working closely with hospitals and the Hospital and Healthcare Association of Pennsylvania to manage the number of people hospitalized during this time. Staff there consists of personnel from the city, Temple University, the Medical Reserve Corps, and other institutions. In addition, the Office of Emergency Management and the Philadelphia Department of Public Health continue to plan for ways to expand and staff this site. Currently, the city is hosting members of the National Guard to help advise on best practices for establishing field hospitals. We are grateful to all of our partners, including our host, Temple University, for making all this happen. Through a lot of hard work and cooperation, we've seen an incredibly smooth transition of this site from an empty arena to a fully functioning hospital. And everyone involved should be proud, and I'm proud of all of them. This morning, I had the opportunity to visit one of the new temporary emergency meal sites in response to the COVID-19 pandemic. I was at the temporary emergency meal site on City Hall's North Apron, where grab-and-go lunches are now available Monday through Friday, 11:30 a.m. to 1 p.m. It's 11:30 a.m. to 1 p.m. The other new location is an outdoor site at the intersection of East Clearfield and Ruth Street, that's R-U-T-H, streets in Kensington. Lunch is being offered there from 1 p.m. to 3 p.m. Monday through Friday. 1 p.m. to 3 p.m. Monday through Friday. All members of the community, sheltered and unsheltered, are welcome to partake. This collaborative effort is called Step Up to the Plate. I'd like to thank our partners in this, Broad Street Ministry, Project Home, and Prevention Point Philadelphia. These organizations are working closely to provide meal services to continue while maintaining appropriate physical distancing guidelines. The City Hall location is a sibling site to meal operations at a third location, the Hub of Hope, above ground at Thomas Paine Plaza, across JFK Boulevard at the MSB building. That site serves dinner Thursday through Monday, 4 p.m. to 5:30 p.m. and is operated by city partner Muslim Serve. 3 local catering companies, Catering by Design, 12th Street Catering, and Herb Scott Catering, will provide meals at cost. By collaborating with catering companies, Step Up to the Plate allows its partners to turn their focus towards staffing, logistical, and care concerns for their guests. The current projection is to serve 1,000 takeaway package meals per day, each package containing lunch and dinner, for a total of 2,000 meals provided each day. What sets the new sites apart from others is that they respond to the pressing need for meals created by the COVID crisis. They were designed with proper social distancing and other COVID-19 logistics in mind from the very beginning, including procedures for the distribution of the grab-and-go meals. Wraparound services at each site are tailored for the needs of the neighborhood's population. So I was pleased to visit the City Hall meal site and to have the opportunity to thank those committed to helping those experiencing homelessness among Philadelphia's most vulnerable residents. Today, SEPTA and Amtrak are participating in the Sound the Horn campaign to honor heroic transportation and other essential workers across the country. At 3 p.m. today, transit agencies across the country will simultaneously sound their vehicle horns to honor transportation and other essential workers across the United States. This is a tribute to the essential workers on the front lines of this public health crisis, including transportation workers, SEPTA trains, buses, and trolleys running in service across the greater Philadelphia area, as well as Amtrak trains across the nation. Heroic transportation workers continue to provide critical service for healthcare workers, first responders, childcare workers, grocery store employees, and other heroes who are performing critically essential work during the COVID-19 pandemic. We thank them for their service. Thank you, and now I will turn it over to Dr. Farley for his daily update.
Good afternoon. The news from health on the epidemic is mixed today. We received a very large batch of laboratory reports that make it a little bit difficult for us to follow the trends in the number of new cases, but we are seeing continued increases in the number of cases in the city's hospital system or the region's hospital system. So here's more detail. Today we have 604 new cases of coronavirus infection in Philadelphia residents, bringing us to a total of 8,045 cases since the beginning of the epidemic. Now, that daily count of 604 is higher after we've seen a number of days where it's been lower. It's been in the 300 range. But in the past few days, I've noted that we're not receiving as many laboratory reports as we expected. And today we received twice as many laboratory reports as we did yesterday. So unfortunately, our laboratory data is coming in batches, which makes it hard for us to really follow the trends. However, if you look at the graph that we have on our website, you can get a better sense of trends than by just the daily count that I'm reporting here today. And that graph shows that it looks like we've hit a plateau where we've been pretty level over about a week in the number of new cases per day, if you ignore the past few days where we think the data is incomplete. So we may have hit a plateau. I can't say that we're seeing decreases yet. We're looking forward to seeing decreases. I would love to see decreases, but I can't say that it has clearly happened yet. We're continuing to work with providers across the city with clusters that are in congregate care facilities, including nursing homes, behavioral health facilities, and the city's jail. The city's jail cluster currently has 60 inmates who have this infection. That includes 8 new inmates who tested positive, but then 4 others who recovered who are no longer in isolation. The number of cases of the coronavirus infection that it's in the city's hospitals is growing. Within the Southeast Pennsylvania region, the entire region around Philadelphia, we now have 1,541 people with this infection in the hospital. Now, that number seemed to level off over the weekend, but it's been increasing over the past few days. We do expect that after we hit a peak in the number of cases in the community, there'll be a lag before we hit a peak in the number of cases in the hospital, because people are hospitalized after they've had this infection for a while, and they start to get worse. Region-wide, we still have 33% of our regular hospital beds available and 29% of our intensive care unit beds that are available. But some hospitals in the region have more patients relative to their size than others. So some hospitals in the region are at or near capacity, especially for intensive care unit beds, and they may be needing to transfer or divert patients to others. Now, as the mayor said, the Liacouras Center today is open and ready to accept patients. We are in communication with medical officers of hospitals across the region, and our message to them is that if you are at or near capacity and you need to transfer patients, the first thing you need to do is talk to other hospitals about transferring them there, because as much as we are convinced that Liacouras Center can provide excellent care, it's still better to have a patient be in a regular hospital with all the resources of a hospital than at the Liacouras Center. If those hospitals cannot transfer the patients to other hospitals and they still are at capacity, then the Liacouras Center is absolutely there as a fallback. And we're going to stay in very close communication with all these chief medical officers to make sure that is available to them if they need it. News on the number of people who have died from the coronavirus infection. We have 42 new deaths to report today. I'm very sad to say. That brings us to a total of 264. Now, that 42 new one is the highest number of daily deaths we've reported so far. But that increase, I think, is related to the large number of laboratory reports that we received today. You need to have a positive laboratory test in order to confirm a death is being caused by coronavirus. If you want a better sense of the trends in deaths, there's a graph on our website. Of those 264 total deaths, 137 or 52% were in nursing home residents. And our nursing homes continue to be the sites that this epidemic has hit the hardest. More demographics on the fatalities is on our website. Information about testing is as it was before. It's still limited by the number of swabs that are available to collect this and the laboratory capacity to run the samples. If you want more information, just go to our website, phila.gov/COVID, and there are links and phone numbers to all the different sites where testing is available. Now, the hospital data says that definitely we're not necessarily past the worst of this. There's still far to go in this epidemic. I know all of us want to have it be done. We want to be past all this, We're not there yet. I'm hopeful that we're going to be turning a corner soon. Haven't done it yet. So still remember, the virus is out there. It's still circulating. You should assume that everyone you come in contact with has the virus because they may be. So if you have to stay home, if you have to go outside, keep your distance from people. And if you have to be near people, wear a mask. More information on our website, www.phila.gov/COVID, or if you have medical questions, 800-722-7112. Thanks.
Thank you, Dr. Farley. And now Armando will provide the Spanish language translations of both Mayor Kenny's and Dr. Farley's remarks. Armando, you need to unmute yourself there. Thank you. Go ahead.
Mensaje del alcalde Jim Kenney para el jueves 16 de abril del año 2020. Buenas tardes a todos. Como saben, el Liacouras Center de la Universidad de Temple continúa preparándose para recibir pacientes afectados por el coronavirus. Hoy me complace anunciar que este sitio está listo para atender pacientes, aunque obviamente esperamos no tener que usarlo nunca. A medida de que hay más personas que sean hospitalizadas, habrá menos camas disponibles en los hospitales y las instalaciones del Liacouras Center están preparadas para darles atención médica. El personal del Liacouras Center está conformado por personal médico de la ciudad, de la Universidad de Temple, del Cuerpo de Reserva Médica y de otras instituciones. Adicionalmente, la Oficina de Manejo de Emergencias y el Departamento de Salud Pública de Filadelfia continúan planificando agregar más personal en este sitio. Actualmente, miembros de la Guardia Nacional se encuentran en la ciudad para brindar asesoramiento sobre las mejores prácticas para establecer hospitales de campaña. Les agradecemos a todos nuestros socios, en especial a la Universidad de Temple, que hace esto posible. Y esta mañana tuve la oportunidad de visitar uno de los centros temporales de distribución de alimentos creados para aliviar la crisis producida por esta pandemia. Fui al centro de alimentos de emergencia ubicado al norte del ayuntamiento, donde hay almuerzos para llevar que están disponibles de lunes a viernes de 11:30 de la mañana a 1 de la tarde. El otro centro es un sitio al aire libre en la intersección de las calles East Clearfield y Ruth en Kensington. Los almuerzos se entregan desde la 1 de la tarde a las 3 de la tarde de lunes a viernes. Todos los miembros de la comunidad son bienvenidos. Este esfuerzo de colaboración se llama Step Up to the Plate y quiero agradecer a las organizaciones que lo han hecho posible: Broad Street Ministry, Project Home y Prevention Point, Filadelfia. Estas organizaciones están trabajando arduamente para proporcionar servicio de comidas, observando el protocolo de distanciamiento social. La ubicación del ayuntamiento en City Hall es un centro satélite para las operaciones de distribución de comida en una tercera locación, el Hub of Hope, ubicado en la Plaza Thomas Paine. Este sitio sirve cenas de jueves a lunes de 4 a 5:30 de la tarde y es operado por Muslims Serve. Hay 3 empresas locales de catering: Catering by Design, 12th Street Catering y Herb Scott Catering, que están proporcionando comidas. La proyección actual es de servir 1,000 comidas para llevar diariamente, con cada paquete que incluye almuerzo y cena, para un total de 2,000 comidas que se proporcionen cada día. Estos centros se diseñaron tomando en cuenta las pautas de distanciamiento social, incluyendo los procedimientos para la distribución de comidas para llevar. Los servicios integrales en cada sitio están adaptados a las necesidades de la población en cada vecindario. Y me complació visitar el centro de comidas del ayuntamiento y tener la oportunidad de agradecer en persona a quienes se comprometen a ayudar a las personas sin hogar, que son algunos de los residentes más vulnerables de la ciudad. SEPTA y Amtrak están participando en la campaña Sound the Horn para honrar a todos los transportistas del país. Hoy a las 3 de la tarde, las agencias de tránsito en todo el país tocarán simultáneamente las bocinas de sus vehículos para honrar a los transportistas y a otros trabajadores esenciales de los Estados Unidos. Este es un homenaje a los trabajadores esenciales en la primera línea de esta crisis de salud pública, entre ellos los transportistas, conductores de trenes de SEPTA, autobuses y trolebuses que operan en el área metropolitana de Filadelfia, así como en los trenes de Amtrak en todo el país. Nuestro agradecimiento infinito a todos ellos. Y esta es la actualización en materia de salud al jueves 16 de abril del 2020. Desde ayer se han confirmado 604 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 8.045 casos en la ciudad. El conteo de casos ha aumentado después de las disminuciones en los días pasados porque hemos recibido reportes actualizados de los laboratorios y la ciudad está monitoreando de cerca esta información. Así que aún no podemos afirmar que tengamos una caída en el número de casos. Tenemos 8 casos positivos de COVID-19 entre los internos, con un total de 60 casos registrados y 4 internos que se están recuperando satisfactoriamente. Los hospitales están monitoreando el aumento de los casos y hay un total de 1.541 pacientes hospitalizados en el sureste de Pensilvania. Reportamos también, tristemente, 42 nuevos fallecimientos en Filadelfia. Hay un total de 264 personas que han muerto por la COVID-19. Y este es el número más alto de muertes que se ha reportado hasta el momento. Para confirmar que una persona ha fallecido por la COVID-19, se requiere una prueba de laboratorio. De estas muertes, 137, o el 52%, se han producido en hogares de ancianos. Hay que recordar que este virus no discrimina por raza ni por género. Las pruebas están disponibles, pero son limitadas. Hay retrasos en el reporte de casos positivos y usted puede encontrar mayor información sobre los centros de pruebas visitando fila.gov/COVID-19, pestaña FAQ. Los datos obtenidos de los hospitales nos indican que todavía no hemos pasado la peor parte de esta crisis de salud pública. Tenemos que cumplir con la medida de permanecer en casa para poder permanecer seguros porque el virus sigue circulando en el ambiente. Si no respetamos la orden de permanencia en casa, el virus se propagará rápidamente. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos, utilizar máscaras de tela en lugares públicos donde las medidas de distanciamiento social sean difíciles de mantener. Y le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas del día, 7 días por semana, al 1-800-722-7112 y esta llamada es gratuita. Gracias.
Great. Thank you, Armando. Now we will move to the Q&A portion for members of the media. And again, we'll ask our speakers to join us by audio and video. Remember that we have limited time during these briefings, so only one representative for each media outlet is permitted, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. And for those logged in today, please use the raise your hand feature that is found under the participants list. We will unmute you one by one as we call on you for your questions. First up today is Jeff Cole of Fox 29.
Yeah, I want to start with Dr. Farley, if I could. Dr. Farley, the Inquirer today on its business section is reporting that the Einstein system expects to lose $70 million by June. Have you tried to assess the financial health of hospitals in the city? And if you have, what's your concern? What are you seeing about what COVID-19 is doing to the financial health of the region's hospitals?
I have not tried to assess the financial health of that hospitals or other specific hospitals. However, I do know that in anticipation of the healthcare surge, that hospitals canceled elective surgeries and had a long period of time there where the number of patients in the hospital was far lower than usual, which means they got a lot less revenue than they ordinarily get. So I suspect that they were having financial problems as a result of that. And these hospitals will need some sort of financial support, maybe from the federal government. We need to keep these hospitals afloat.
Einstein says that it plans to furlough workers. What's your view of its decision to do that? And have you heard that from other hospitals in the city?
I have not heard that from other hospitals. I do know that hospitals, that they rely on the revenue from patients being in hospitals in order to stay afloat, and so they may be, having to face some difficult decisions. The hospitals that are, having a lot of patients, I'm not hearing of any of them furloughing staff. They need to keep the staff in order to treat the COVID patients. But I would just say again, I'm more concerned over the long term than over the immediate term. The hospitals need to have enough financial support in order to stay open.
Okay, and I just had a question for the mayor real quickly. Mayor, there's been a shooting overnight, and I guess the early reporting is that a man who claims that he had the right to carry has shot, I think, 3 others on a SEPTA bus. Are you concerned with the surge of purchasing of weapons that this speaks to some belief that folks believe they need to be able to carry and carry legally? And secondly, is it some symbol of a boiling over in the city based on simple frustrations over how people are living? That's for the mayor.
Well, first of all, I think generally people have been helpful, cooperative, and concerned show concern toward each other. Certainly, I don't know the details of this and what the rationale behind it was, but I've always believed there's too many guns in the society. I didn't think gun shops were an essential business, and I think that it's the way this country is. And I don't know if I'm going to be able to change the mindset of this entire nation when it comes to having weapons, carrying them, multiple weapons. If he's carrying the gun legally, we'll have to look at the details of the shooting and find out what went on. Whether he had a gun legally or not doesn't mean he was right in what he did, and I'm sure the investigation will vet that out. And if appropriate action is needed against the person who shot, who was the shooter, I'm sure the police will do what their job is.
Thank you.
Thank you, Jeff. And next up, Layla Jones, Billy Penn.
Okay, let me turn my video on. Hi. So my question is, there's a new site in Montgomery County where they're letting people do self-swabbing for testing. So I guess this will be for Dr. Farley. Is that a different kind of swab, and do you expect that would speed things up at all?
There is a different kind of swab used for self-testing than to have a medical provider do the test. We have some concerns about how accurate that test is. We think a medical provider can do it better than someone just doing it themselves. There are some sites that are doing that, and I think that's fine, but we're not encouraging that in the sites that we're supporting in the city.
Okay, thank you.
Layla, did you have anything else?
Nope, that's it. Thanks.
Very good. Thank you. Nina Feldman of WHYY is up next.
Hello. The state is reporting that 41 different long-term care facilities in Philadelphia County have coronavirus cases. Is that number correct as far as you know? I just know there's been some data reporting discrepancies on the county and state level. So is that the right number?
I don't have an exact number for you. That sounds approximately correct. Yes, it's a large fraction of the nursing homes or long-term care facilities in the city have at least one case.
And that was my follow-up question, is if you can give what percentage of overall facilities that number is that has a case. I don't
have that number for you, or we can get that number for you.
Okay, thank you. That's it for me.
Okay, thank you, Nina. And if you shoot us an email, we'll try to get that for you. Next,
I appreciate it.
Martin Pratt of Philly YBN.
Hi, this is for and for Bryant. What would you categorize at this point the grade for Philadelphia's response? Do you feel like you're a C plus, B minus, maybe an A?
Ryan, there?
There you go. Go ahead, Mayor.
Mayor, you want to tackle that?
Yeah, I don't really know. I mean, I appreciate the question, and it's not an uncommon question in when you're assessing things. But this is so extraordinary and so historic and so serious. I don't know whether or not we could assess a grade at this point. I think at the end, when it's over, we can do a rehash, find out what we did wrong, what we did right. And I'm not prepared to. I think it's still the beginning of the semester. I don't think we're ready yet for a grade.
Okay, this is for Dr. Farley. Dr. Farley, everyone is required to wear a mask now, and a lot of people are wearing cloth masks. Would you suggest any type of detergent to clean those cloth masks with, to make sure that they're actually, not reinfecting themselves, or or there's something that came on the cloth mask? Is regular household detergent good enough to clean these cloth masks with?
Yeah, the virus is fairly easy to kill, so you don't need any particular detergent to use, just a regular detergent. Be good to dry it in a dryer and make sure it's hot. That heat can also just be doubly sure that you kill the virus, but no special detergent needed.
And lastly, are the sanitation workers, again, I hate to be the one always talking about trash, but we're still seeing an increase of disposed masks and gloves in my neighborhood, at least, and on the ground. Are the sanitation workers being given any protection, PPE stuff to wear when they have to pick up this type of trash?
Yes. So sanitation workers are provided gloves and cloth masks for all sanitation workers. That's been distributed now for a couple of weeks.
Thank you.
Longer, actually. Yeah. No problem.
Thank you, Martin. Next up is Jack Tomzik of Metro.
This is for Dr. Farley. How many hospitals are at or near capacity, or what, or a quarter of hospitals or a third of hospitals, but, how many are, getting to that point where they're near capacity or at capacity?
I can't give you a hard number because the data we have just isn't accurate enough to say that. I would say it's a minority of hospitals in the city. Again, the overall, we have plenty of access to beds, but, it's a small fraction of the city. And I can say we're looking at across the entire region, not just in the city of Philadelphia.
Okay. And for the Liacouras Center site, do you have any idea of when that will need to start taking patients, whether that be next week, or do you have any idea when that site will need to be used?
So to be clear, it is ready to receive patients today. However, we don't see that there's a need for it today. We are talking to the hospitals across the region. And if they are at capacity and they feel they need to transfer patients elsewhere, we're saying your first step should be to transfer patients to another hospital that has capacity. If for some reason they can't do that, then and they have patients that are appropriate for the Liacouras Center, then the Liacouras Center is available for that. So I can't say whether the Liacouras Center will ever have any patients, or I can't say whether they might have them today. It really depends on what happens in the hospitals across the region.
Okay, thank you.
Thank you, Jack. Pat Loeb of KYW is up next.
Thanks, Mike. I had a question. I'm not sure who this is for, but the inmate numbers are different than the overall case numbers in that you subtract those who have recovered. And I'm wondering if you have like a running total, how many inmates overall have contracted the virus?
If you wait 1 second.
I got it, Tom.
Okay, go ahead.
Yeah, we have 100 inmates overall that have contracted the virus. And again, only 60 are remaining in isolation. The rest have shown that they no longer test positive.
Thank you. And this is for Dr. Farley. Last week or maybe it was even the week before, you had rapid tests that you'd been given and you were trying them out in the lab. What were the results of your testing of those tests? Were they accurate?
Yeah, so it took us longer to do the validation study than we wanted to. I have not gotten results yet. I was told I might get that tomorrow.
Okay, thank you.
Thank you, Pat. Next up, we have Laura McChrystal of the Inquirer.
Hi, my first question is for Dr. Farley. You mentioned you got a large batch of test results today and you perhaps weren't getting reports from all labs the last few days. Could you just explain a little more what's going on there and any reason that you've found out why it might be happening like that?
I wish I understood how this works, because I would asked in the past couple of days, and we even had our staff speak to the laboratories themselves, and the laboratory said, oh no, you're getting all of our results every day, no problem. Nonetheless, we got about 800 results yesterday and close to 1,500 results today. So and our results today often are for people who were tested a number of days ago, 5, 6, 7 days ago. So I don't fully understand why we're getting the data in batches, but I wish I did understand that. And if we can, we'll try to fix it, and then we would smooth out our data.
Okay. Another question for you, Dr. Farley. I know you were just asked about the hospitals, which are at or near capacity. A slightly different question than that is, to your knowledge, have any hospitals yet already reached capacity and actually had to transfer patients to other facilities?
You know, hospitals transfer patients to other facilities as a routine matter. You know, if they have a particular situation where they can't handle it or a specialist is elsewhere not available to them. And so I don't know where they draw a line. I know that some transfers have occurred in the past few weeks. I'm not really sure if that's because of capacity or not. I would say there have not been large-scale transfers that have happened yet.
Okay, thank you. My last question is probably for Brian. Are there any provisions that the city is making, given the cold snap that we're having this week, for the homeless population?
So I think we're consistently making additional provisions for our unsheltered. You know, I think we are looking at additional shelter capacity in Kensington. You know, but I don't think we are not specifically adding shelter capacity in Center City or standing up any sort of temporary shelter currently, given the weather. I think we are continuing to try and address it holistically, given the large number of unsheltered individuals that we've seen and the strain and stress on our shelter system as a general rule.
Okay, thanks.
Thank you, Laura. Next up is Gray Hall of 6ABC.
Oh, hello. Thank you so much for this opportunity and for providing this update to the public. The first question, I guess, would be for Dr. Farley, and the last two would be for the mayor. Dr. Farley, if you could talk more about the Liacouras Center, who's going to actually staff if and when we see patients having to use that facility?
So the clinical staff there come from three different sources. They come from our Medical Reserve Corps. These are volunteer doctors and nurses who have registered in the past or recently that have these skills and are interested in working there. There are also some clinical staff that we have contracted out. There are companies that do that have staff that you can contract out with. Plus, we've now received support from the Department of Defense. Some of their clinical staff have appeared in the city. We may or may not need them, depending on how many patients we have and how many of these other staff we have.
And will there be a process of, will they just say we need to use that and they can just use that facility? They just send their patients there?
No, there's definitely a process. First, we need to determine if we need the facility at all, and that will be based upon the need over the entire region. If we are using the facility at all, then the chief medical officers of a hospital that wants to send patients there has to talk to the chief medical officer of the Liacouras Center about the details of each specific patient, make sure that the patient is appropriate to go to that site, and they would get approval from the Liacouras Center chief medical officer before the transfer happens.
Dr. Farley, thank you. If I could ask the mayor now a question. Mr. Mayor, could you talk to us about, we know that the president is asking to relax social distancing and reopen parts of the country. What would that look like here in Philadelphia? And would you follow those guidelines?
That wouldn't happen here in Philadelphia until the science folks and the medical folks tell us that it's okay to do it. And I think that's pretty much the consensus in the majority of the country where there's a large populations. There may be areas of the country, states that have very small populations. I don't know what their situation is. But if you look along the entire East or West Coast, I don't see anybody going along with that because we would be knowingly putting people's health and life in danger.
And last question, this is in regards to the PPA, and there's been a huge loss of revenue because of COVID-19. How has it impacted revenue? And do you see easing restrictions when it comes to PPA and the parking restrictions?
We don't have a full impact yet as to what it's done to our budget or the school, more so the school district's budget than anything else. We're all doing that analysis now, and hopefully by May 1st or thereabouts, we'll have something for the city to put forward. The school district's another total separate budget, and we'll know. It's certainly going to have a negative impact, and at this point, we're not looking to change any restrictions.
Thank you so much.
Okay.
All right. Thank you, Gray. Perla Lara of Impacto is up next.
Yes, I'm sorry. Are
you there, Perla? Hold on.
¿Me escuchas?
Try it now, Perla. Go ahead.
Ok. Sí, bueno, mi pregunta primero para el alcalde es ¿cómo se siente? ¿Cómo anímicamente se siente durante toda esta crisis? ¿Cómo está él?
My first question is for the mayor. How are you feeling, emotionally speaking, about this whole crisis?
Certainly, I'm a human being like everyone else and have my own concerns about family's health, my own health, friends' health. But I'm in a position, I'm in a job that requires me to push that aside a little bit and to make sure that we look out for everyone else who lives in the city. In addition to our citizens, our first responders, our city employees, sanitation workers, people who work in nursing homes. I mean, all that. It's sometimes a little bit overwhelming, but as I said before, the staff that we have here, the crew of people who are working on this are top notch, and it takes a lot of burden off my shoulders and my brain.
Primero, quiero decir ante todo que soy un ser humano y por supuesto tengo mis propias inquietudes y preocupaciones con respecto a la salud de mi familia, mis amigos y mis asociados y mi propia salud. Nuestro trabajo, sin embargo, y el mío, es de cuidar por la salud de todos los ciudadanos en la ciudad, de los socorristas que están en la primera línea de respuesta, los trabajadores sanitarios, el personal que está en la casa de los asilos de ancianos y, por supuesto, el personal de sanidad también. Y nuestro plantel tiene experiencia, es de primera clase y vamos a remontar esto.
Mi segunda pregunta sería, otros países han enfrentado esto con más eficacia, tal vez porque han tenido más miedo las personas. Aquí como que muchos todavía no creen ni siquiera que existe, que esto es real. Hay quien me ha dicho que para los inmigrantes, por ejemplo, esta es una forma de correrlos del país, de espantarlos para que se vayan. Podría ser, como no hay pruebas para todos, podría ser una estrategia más eficiente el decir que realmente todos estamos expuestos a contagiarnos o a contagiar y deberíamos de actuar como si tuviéramos, como si fuéramos potencialmente ya alguien que lo tiene y potencialmente un peligro. O sea, como la gente dice, no, yo no me tengo que hacer el test, es porque realmente no estoy en peligro, pero generalizar este sentimiento de actuar en cuarentena, visto que el 25% no tiene ningún tipo de síntoma, ¿no sería alguna estrategia más fuerte para que la gente permanezca en casa realmente?
Lo que dices, Perla, de alguna manera es que si se tendría que cambiar el mensaje para hacerlo más serio, de que la gente realmente corre un riesgo, aunque no lo sepa o no crea en ello, ¿correcto?
Sí, ese es el mensaje, principalmente porque hay 25% de la población que tiene el virus que no tiene ningún síntoma.
Bien.
Y está contagiando o contagiándose.
¿Cómo no? The question is, would it be more efficacious if there were people were more scared in general, because there's plenty of people that do not believe that this is as serious as it is. And there's been rumors even that the immigrant community is being scared so that they would leave the country. And wouldn't it be more important to have people believe that they're exposed to the infection, as there's about a 25% of people who have it and don't show any symptoms? Wouldn't it be better to follow the example of other places and get people more scared in a way to take this seriously?
Well, I don't want to see people scared. I want to see people act in a mature and an adult way, understand and recognize that this is a serious and real crisis and real virus. It is a virus that has been described as hunting human beings. And it's really a very clear description of what this virus is. So I don't want to scare anybody into doing, stupid things, but I do think that we got to continue to reinforce the fact that this is serious and that we can't go back to we may never go back to our old life. We may never go back to where things were just a month or two ago. But it's also not helpful when the White House keeps sending mixed messages that somehow Easter Sunday is going to rise us all from the dead, and that May 1st is some magic day. Those are the things that scare me. That scares me as much as the virus does, because that puts people in a situation to think that it's okay to resume their former activities. I don't want to scare. I understand what the purpose of the question was. I don't think I used the word scare. I think I used the word inform and make sure that people act in a mature and adult way.
Quiero responder que no me gusta la palabra de atemorizar o meterle miedo a la población para que haga lo correcto. Lo creo que es importante es que la gente actúe de una manera adulta y madura para enfrentar esto, porque esta es una crisis real y realmente se ha descrito este virus como es un virus que está cazando a los seres humanos. Por lo tanto, no creo que sea importante que la gente tome medidas a raíz del miedo, sino creo que es importante reforzar el mensaje de que esto es una crisis seria y que no se puede volver al tiempo atrás. Tal vez nunca volvamos a tener lo mismo que teníamos antes. Decir que vamos a volver a la realidad de hace 1 o 2 meses atrás. Lo que a mí sí me da miedo es los anunciamientos que salen de la Casa Blanca que dicen de que vamos a volver a renacer con la Pascua y que todo va a volver a la normalidad para el 1 de mayo. Yo creo que eso a mí me da miedo. Creo que la gente tiene que pensar que va a estar bien, pero que tiene que actuar por madurez y por integridad, no por temor.
Gracias.
Thank you.
Thank you, Perla. We're going to go to Brian McCrone of NBC 10, and then we'll have a second round for those who've already asked questions.
Hey, everybody. Who is the chief medical officer for the Liacouras Center?
His name is Dr. Tony Colletta.
How do you spell Colletta?
Colletta.
Where's he from?
He is a physician that worked for a company called Tandon Health in the Philadelphia area before this.
Okay. All right. That's it. Thanks.
All right. Thank you, Brian. We'll go to back to Pat Loeb of KYW.
Thanks. PICA reported today that revenue was actually up for the third quarter. I wondered if that surprised you, if you consider it good news. Just like to get a response to the PICA report.
Well, I mean, I don't think it's really reflective of where we've been in the last 30, 40 days. So glad it's up. Don't depend on it going forward.
Did the specific amount that they reported give you any indication about what cuts might be needed?
No, I think that, again, this all came into place towards the end of the quarter. So I think it's really kind of it's not a leading indicator.
Thank you.
Yeah, and Pat, I just want to make it clear too. I think it's really important to remember what the third quarter is January, February, March. So it doesn't really indicate the revenues that we have lost as a result of COVID-19.
Thanks.
Pat, you're all set?
Yes, thank you.
All right. Layla Jones of Billy Penn, you're up.
Thank you. Mayor Kenny, you mentioned that the city's getting help from the National Guard. I'm wondering how many troops are deployed in the city and where exactly will they be helping?
I'm not sure. First, I wouldn't call them troops. I mean, I'd call them the National Guard. They're not armed. They are there as extra hands and legs and backs, and they're dedicated young people who want to help in times of disaster, times of crisis. I think maybe Brian may have an idea better where they're assigned.
So the folks who are here are really providing technical assistance around the hospital and the Liacouras Center. These are not at this point. We don't have the National Guard supplementing any of our operations. We can get you specific numbers back. And I do want to make a point. While I think the mayor did say National Guard, it's actually the medical reserves as well. So just it's coming through the federal government, but isn't like they're it's more Department of Defense medical assets than they are National Guard troops, like you would imagine from the 1960s kind of thing. So these are again medical assets, not guardsmen who are patrolling our streets, that kind of thing.
Sure. And you guys could get me the numbers for that? How many people are here from that organization?
Yeah, we should be able to get you a number.
Okay, thank you.
And Layla, if you could email us at press@phila.gov, we'll get that to you. So thanks. Gray Hall of 6ABC, you're up.
Thank you. Excuse me. Final question, and I'm not sure if it's for maybe the mayor or Dr. Farley, but overall, how do you think residents are doing with social distancing? And do you think that maybe by wearing masks, people may have the mindset that this will help loosen restrictions, like when they go out, not being as careful, or maybe giving them a false sense of security by wearing the masks?
Well, I'll just go anecdotally. I mean, I was in a CVS yesterday with a mask on. Everyone in the store had a mask on. The aisles were marked with yellow tape and signs to say distance. People were following that. People were stopping where they were walking to let someone else go by if they felt the distance was getting too close. So I think generally people are being very responsible about all this. We also have a cadre or cohort of people that, still congregate and tailgate and do. I mean, it's just there's a various groups of folks doing various things. But I think for the most part, people understand the seriousness of it, and they're keeping a distance from each other. And I don't sense it's lightening up. I don't know if the doctor has a different opinion.
No, I feel the same way. We did a survey that indicated that the large majority of Philadelphians are following the recommendations. Not everybody, but overall, the response has been good.
So much.
Thank you, Gray. And we'll go back to Laura McChrystal of the Inquirer. All right, Laura, hold on one second. Laura, give it a go there.
Just a quick question. How many people are quarantined at the Holiday Inn as of today?
You know what? I don't have an updated number. I'll get that to you and have Mike send it back out to you.
Thanks.
All right. Thanks, Laura. And now Aaron Moselle of WHYY.
Hi. You mentioned that 100 county inmates have been tested positive so far. Do you have a number of how many you've tested overall, positive or negative?
I don't. We can see if we can get that number, but I don't have that number unless you do, Dr. Farley. No. All right.
No, I don't have that number either.
Okay. One other question is from another reporter at HYY. Is the city considering relaxing rules for homeless entry to quarantine sites, given the decreasing shelter space and low admittance at the Holiday Inn? And will the homeless be allowed in any of the new quarantine sites or homeless families?
So we're reviewing our protocols for entrance into the quarantine site. The Holiday Inn won't become an ad hoc shelter, but I do think we needed to review those protocols, and I will be updating appropriately and expect that census to go up. As that census goes up, we'll reevaluate how our facilities are being used and may adjust going forward. At this point, we have plenty of room at that facility, so I'm not concerned. But if that changes, we'll certainly readjust and reallocate appropriately.
Thank you.
Aaron, are you set?
I'm all set. Thanks, Mike.
Denise Clay of The Sun, you're up next.
Hi. Is the Hub of Hope still open? Are homeless people still congregating there?
No, the Hub of Hope is not open. They are providing services outside. And again, the feeding location or the food distribution site on the north side of City Hall is in an effort to supplement what the Hub of Hope was providing.
Okay. And Dr. Farley, do you? I know that the governor through the Department of Health signed an order mandating that everybody wear masks if you walk into if you're going into public buildings or if you're anywhere where you're around people. Is the same thing? Is Philadelphia kind of taking that guidance and applying it to us, or is it still kind of like you can wear a mask if you feel that you should and you don't necessarily have to?
The Centers for Disease Control a week or two ago made a recommendation that people, if they have to go out for an essential errand, like going to the grocery store, wear a mask. So that's still a recommendation. We don't plan to take specific steps to enforce that. I think many people are following that. But okay. That's our recommendation.
Okay. Okay, well, that's it for me.
Great. Thank you, Denise. Ryan McCrone of NBC 10, you're back up.
Hey, thank you guys again. I wanted to touch base. I think you mentioned a little bit about it very early on, and I just want to round it out and make sure I got it covered. The nursing homes. Can you give me some specifics about what the city, I mean, the Department of Health in particular, is doing to support nursing homes in Philadelphia and maybe on a broader perspective, Doctor, what you think is happening in nursing homes, why it's spreading so much or so fast in some nursing homes.
Yeah, so nursing homes are vulnerable in a couple of ways. One of them is it a congregate setting? In all congregate settings, there's an increased risk of transmission from one person to another. And then it's a congregate setting where the people are unusually vulnerable. That's why they're there, is that these people are frail. So this has been a problem across the country. You've seen major mortality rates in nursing homes all over the country where the epidemic has been there. So we have been working with nursing homes since before the virus came to Philadelphia with routine conference calls to talk to them about what steps they can take for what's called infection control. That's trying to prevent the introduction of the virus or the spread of the virus in the facility. And if it gets in the facility, to try to prevent further spread. And that includes things like having the staff wear masks all times. When you're testing people who are symptomatic, and if you have people who are positive, you keep the positive separate from the people who are negative. I can tell you the nursing homes are working hard to put those steps into place. We are working hard, and when we have a case in a nursing home, we work directly with that nursing home to give them specific advice. It's proven to be difficult, though. We're having struggles here, as they're having everywhere. We do think we protected most of the people in nursing homes, but we haven't protected enough. So we're always continuing to look at this and saying, are there additional steps that we should be taking? We haven't taken so far, and we'll continue to do that.
So are there any nursing homes in Philadelphia that you're particularly concerned about?
I'm concerned about every nursing home in Philadelphia. Okay. Every nursing home has a group of very frail people in it. And if the virus gets in there, it can infect a lot of people and have a lot of deaths. And so we're trying to work as closely as we can with all of them to try to limit the virus spread there.
Did you, and again, I don't know if you gave it out earlier. I remember a 41 number. Is that the number of nursing homes, or whether, I just wondered, do you know the number of patients that have either come from or been reported out of the nursing homes in Philadelphia?
I don't have a number for the patients. We have a number for a number of deaths that have occurred in nursing homes.
What is that again?
No, I read it when I gave my talking points. Hang on one second. It was 137 of our deaths, which is a little more than half of the deaths that occurred in the city were in nursing home residents.
Okay. All right.
All right. You're all set, Brian?
Thank you. Yes. Thank you.
You got it. All right. We have no other hands raised. So this is the last chance if anyone has any further questions.
Hey, Mike, can I also, the Holiday Inn number I got, I just wanted to provide it.
Go ahead.
So the 39 individuals at the Holiday Inn today.
Thank you. And thank you again for joining us. We will resume this briefing again tomorrow at 1 p.m.